Hello, Aaliyah. My name is Angela, and I will be your nurse on today. On today, Aaliyah, I will be assessing your eyes, your ears, your nose, your mouth, and your throat. Aaliyah, I will be assessing those areas, so of course I will be actually touching those areas. Should you feel any form of discomfort, please let me know and I will stop the assessment, okay? Okay. So what I'm going to do, Aaliyah, is I'm going to begin with your eye assessment, okay? I'm going to provide you with this Snelling chart. Okay, and with this Snelling chart, what I'm going to ask for you to do is I'm going to ask you to read lines 3, 4, and 5. Cover your eye, and then uncover that eye and cover the other eye, and then to recite it without no cards covered. Okay, go ahead.
T O Z P D C L P E D.
Okay, and you can read the same lines.
T O Z P D C L P E D.
Okay, and if you can actually read it with it uncovered now.
T O Z P D C L P E D.
Very good, Olivia. Okay, so upon completion of the Snelling chart, you have a 14 by 14 visual acuity, and so that we did assess the cranial nerve for your vision, okay? Okay, so next what I'm going to do is I'm going to actually be assessing your fusion reflex, okay? So what I'm going to do is I'm going to ask that you cover your eye with this card, look straight ahead, so and pinpoint that object, and then I'm just actually checking to see if it's the reflection is actually equal. Okay, go ahead and uncover that eye and cover the other one. Okay, you can uncover it. And your focus was on that area, so it is equal. Now what I'm going to do is I'm going to actually be assessing your eye movement. Okay, so what I'm going to be doing is I'm asking you to look at this pin light, and I'm asking you to follow it, okay? And what I'm doing is I'm checking your cranial nerves for your eye muscle, and that is your trochlear, your abducen, and your ocular motor, okay? Okay, very good, Aaliyah. Okay, so then next what I'm going to be doing now is I'm going to be assessing your eyebrows, your eyelashes, your eyelids, and then I'm going to move forward with your sclera, your iris, and your pupils. Also your conjunctiva and your lacrimal apparatus, okay? So right now I'm going to actually be assessing your eyebrows. Okay. And they appear to be symmetrical. There's no dry or flakiness, and they're evenly distributed. As well as your eyelashes, they're evenly distributed as well. If you could please close your eyes now. I'm assessing your eyelids. There's no protrusion, or they're not sunken. They are firm. Is it tender?
No, ma'am.
Okay. What I'm doing now is I'm going to actually check for conjunctiva, and that's the pink portion of your the inner part of your eye sockets, okay? I'm checking to see if there's any redness, drainage, or irritation, okay? If you could please look up as I pull down on your eyes. Okay. It is pink and it's moist. I do notice some small blood vessels. No drainage noted, okay? I'm going to also be assessing your eyelid, okay? So I'm just going to flip this. I'm going to be checking your eyelid as well. And it is pink and moist as well. Likewise there as well. Okay, so what I'm going to be doing now, Aaliyah, is I'm going to be checking your lacrimal apparatus. If you could please close your eyes. And that's your tear production. I'm just palpating right here. Can you tell me if it's tender?
No, ma'am.
Okay, you have a good tear production, okay? Now what I'm doing is I'm going to actually check your sclera. The sclera is the white portion of your eyes, okay? So your sclera is white, it's both of your eyes, okay? Your iris is brown, they're round, and they are the same shape and color, okay? Now what I'm going to be doing is I'm going to actually be assessing your pupils, okay? And I'm actually checking to see if your pupils are equal, they're round, They react to light and accommodation, okay? So what I'm going to do is I'm going to take this pen light and I'm going to shine it in your eyes, and I'm checking to see if your pupils constrict, okay? So what I'm going to do is I'm going to dim the light. Okay, I'm going to ask that you look forward, and I'm going to actually be assessing your pupils, okay? Your pupils are equal, they are round in shape and size, and they react to light and accommodation. So now what I'm going to do, Aaliyah, is I'm going to assess your red reflex, okay? So I'm going to take this red pen light, and I'm going to actually shine that red light, and I want to see if it's going to reflect off of your retina, okay? All right, just look straight ahead for me, okay? Okay. And there was a reflection, a red reflection. Okay, so now what I'm going to do, Aaliyah, is I'm going to move right along, and I'm going to be assessing your ears, okay? First test I'm going to perform is the whisper test, okay? So I'm going to ask that you would cover your left ear and repeat what it is I am saying, whispering, okay? I'm checking your acoustic cranial nerve.
Today is Saturday.
Okay, if you can cover your other ear.
Tomorrow is Sunday.
Very good, Aaliyah. Okay, so Aaliyah, at this time, what I'm going to do is I'm going to actually move right along to the Weber test. And what the Weber test is a bone conduction test. I'm going to take this tuning fork, I'm going to tap it in my hand, and I'm going to actually place it on the top of your head. And what I'm going to do is I'm going to ask you to let me know if you hear the equal sound conduction from both of your ears. If it's unequal, let me know as well, okay? Okay, so you did hear equal, and that lasts for about 5 seconds. Okay, so now what I'm going to do is I'm going to actually perform the air conduction test, and that is the Rhines test. I'm going to use this tuning fork again, okay? And just let me know. I'm going to apply it to your master and process, and just let me know when it stops, okay? The sound conduction.
It's stopped.
Okay.
It's stopped.
Okay, and I'm going to perform that on the other side as well.
It's stopped. It's stopped.
Okay, and that lasts approximately 10 seconds, Aaliyah. So from the results of the air conduction and the bone conduction, we do notice that the air conduction lasts longer than bone conduction. Okay, so bone conduction was for 5 seconds and air conduction was actually 10 seconds. Okay? Okay, so what I'm going to do now, Aaliyah, is I'm going to be inspecting your external ear, okay? So I'm actually checking to see if there's the same shape, they're symmetrical, and in the same size as well, okay? So they are the same shape, they're symmetrical, they're the same size, okay? When I palpate them, can you tell me, do you feel any tenderness?
No, ma'am.
Okay, very good. Okay, so now what I'm going to do is I'm going to actually be looking in the inner portion of your ear, okay? And I'm just checking to see the amount of wax you have, if there's any redness or any lesions, and I'll be assessing the tympanic membrane, okay? Okay, there's a scant amount of yellow brown serum wax. Okay, there's no redness, no lesions. Tympanic membrane is flat and gray. Okay. I'm going to perform the same assessment on this side as well. Okay, there's a scant amount of yellow brownish serum wax. There's no lesions. There's no redness. And the tympanic membrane is flat and gray to this ear as well. Okay. So next what I'm going to be doing, Aaliyah, is I'm going to actually be assessing your nose, okay? And with your nose, I'm just checking to see that it is midline. Your nostrils are equal, they're round, they're patent, and your septum is midline, okay? There's no foreign bodies. Let me just look at the light. Your nasal mucosa is dark pink. There's no foreign bodies noted, no redness or lesions noted as well. Okay, what I'm going to ask you to do now, Aaliyah, is I'm going to ask you to cover one nostril and breathe. And just let me know if you have any difficulty breathing in through your nose. No difficulty?
No, ma'am.
Okay, and cover the other. And same. Any difficulty?
No, ma'am.
Okay, very good, Aaliyah. Now what I'm going to ask you to do, I'm going to be doing, Aaliyah, is I'm going to be palpating your sinuses, okay? So I'm going to be touching your sinuses. Just let me know if there's any tenderness, okay? Any tenderness?
No, ma'am.
Okay, very good. Okay, so Aaliyah, now what I'm going to be doing is I'm going to actually be assessing your mouth, okay? So with me assessing your mouth, I'm going to ask that you smile first. I'm going to assess your lips, and they are equal. They're symmetrical. In other words, they're pink. There's no chapping or no cracking, and they appear to be smooth and moist, okay? So next I'm going to ask you to open your mouth, and I'm just checking your teeth. You look like you have all 34 teeth. Your teeth are white. I don't smell any odor. They are smooth, and at the same time, your oral mucosa is pink and moist. Okay? So I'm going to use this tongue blade, Aaliyah, and I'm going to apply this tongue blade to your tongue, and I'm just checking the posterior pharynx of your mouth, okay? Stick your tongue out for me. Okay, it is pink and moist as well. Your tonsils are as well. I do notice that you have the papillae, the back of your tongue, and the uvula as well. Okay, so what I'm going to ask you to do is say ah.
Ah.
Okay, and I did notice that the uvula did raise up, and that is actually your the vagus cranial nerve. Now what I'm going to ask for you to do is we have your other cranial nerves, which is your swallow gag, and that's the glossopharyngeal, and then you also have the your hypoglossal cranial nerve. If you can actually move your tongue in your mouth around. Very good. I notice your salivary glands. Okay. Nothing is, it's not swollen or anything. Your gums are pink. No swelling. Okay. Your soft palate is pink as well. And it's moist. Okay. And you were able to move your tongue around as well. Okay. So Aaliyah, at this point, this actually concludes our assessment of the eyes, the ears, the nose, the mouth, and the throat. Did you experience any discomfort or tenderness during your assessment?
No, ma'am.
Okay, so at this time, this concludes our assessment, Aaliyah. Thank you.
Thank you.
Okay, and so what I would do at this time is I would report it off to my nurse that I did perform the assessment of Aaliyah's eyes, ears, nose, throat, and mouth. I did not find any abnormal findings. Should I have found any abnormal findings, I would actually perform a focus assessment. Thank you.